This is Chapter 6, Oral Medication Doses. What we're going to be doing is more of what we have been doing, except it's now much more in a medical context. We're going to be getting some information off of drug labels and then using that in the dimensional analysis that we've done before. Okay, so let's look at problem 6.1. The order reads Cymbalta 60 milligrams by mouth daily. Read the drug label shown. How many capsules of this antidepressant drug will you administer to the patient? Okay. First thing I know is I want to take 60 milligrams and I want to change it into my unit is going to be capsules. Okay. So I'm going to I need to see if I can find a relationship between milligrams and capsules. Well, if I look at this, these are capsules. There are 30 in the package. This is what I need though. Each capsule is 30 milligrams right here. And even explains here, it tells this and it is equivalent to this other medication. So what we're going to do is we're going to create a unit fraction with 30 milligrams equaling 1 capsule. I want to take 60 milligrams. I'm changing it, so I put it over 1 times. There are 30 milligrams for each capsule. And then when we multiply, the milligrams cancel out. We get 60 divided by 30, which is 2 capsules. Now, I know this one was fairly easy and you just did it in your head and it seemed automatic, but they're not all going to be that way. That's why I'm writing out all of the steps right now, just so you can see what happens and you can refer to it later if you need to. Okay, 6.2. The prescriber orders this drug that's 40 milligrams by mouth twice a day. Read the drug label shown in 6.2, which is on the next page. I'm going to have to flip it over, and determine how many capsules of this antipsychotic drug you would give to the patient. Again, I'm trying to turn 40 milligrams into capsules. So what I need to look for in the next drug label is how many milligrams each capsule is worth. So right here. Each capsule is 20 milligrams. Okay, it tells you over here, it gets more specific. 20 milligrams is what we're looking for. So the unit fraction, first of all, we start off 40 milligrams, that's what we're trying to change, over 1, times, we know there are 20 milligrams per capsule. And then just like the one above, the milligrams cancel, and we get 40 divided by 20, which is again 2 capsules. Okay. So let's look at 6.3. Read the label in figure 6.3, which is right down here. How many tablets of this narcotic analgesic will be needed for a dose containing 10 milligrams of hydrocodone and 1,000 milligrams of acetaminophen? This is a combination drug. So one of the things we have to make sure of is that the ratio of hydrocodone to acetaminophen that has been ordered is the same as the ratio of hydrocodone to acetaminophen in the drug that we're talking about. So what I want to show is that, all right, we just need to make a choice. We can either put the number of hydrocodone over acetaminophen, or we can do acetaminophen over hydrocodone. We just have to do it the same on both sides. So I'm just going to choose hydrocodone over acetaminophen. I have 5 milligrams to 500 milligrams, which is what I got off the dose here. And I want to know if this is equal to 10 milligrams of hydrocodone over 1,000 milligrams of acetaminophen. Now what I'm going to do is, these are all in milligrams, so I don't need to consider that anymore. What I want to do is to see if these two fractions reduce to the same thing. If I divide each of these by 5, I get 1 over 100. If I divide each of these by 10, I get 1 over 100. So since these two numbers are the same, I can use this version of Vicodin. So my ratios are the same, and that's what I need to worry about. That's the first thing I need to worry about. Now I need to figure out how many of these tablets to give. Since we know that the ratio is the same, we can concentrate on just one of these drugs. If I take care of this one, the acetaminophen will be taken care of as well. So let's change 10 milligrams of hydrocodone into tablets. Okay, each tablet is 5 milligrams. So I take this 10 milligrams that I want, and each one is 5 milligrams per one tablet. And just like on the one above, that should be milligrams, not meters. Sorry, milligrams, these cancel. 10 over 5 is 2 tablets. I promise you will not always be given 2 of each medication. It just so happens this case. Okay. Let's look at 6-4. The order is Ryzolt 300 milligrams by mouth daily. The medication is available in 3 different strengths, and we've got that in the picture down here. Determine how you would administer this dose using the fewest number of the available tablets. Okay, so we want 300. Here's a 100 milligram. I could use 3 pills of this. I have it available in 200 milligrams. I could use 1.5 of this. Or I could have 300 milligrams, which is exactly what has been ordered. So what I would administer if I want to give the fewest amount of pills possible, I would administer 1 of the 300 milligram pills. They're tablets. Okay. 6-5. The prescriber orders an oral solution that is 0.25 milligrams by mouth twice a day. Read the label in the figure 6.6 and determine how many milliliters you will prepare. Okay, so just reading this before I look at the label, I'm wanting to change 0.25 milligrams to milliliters. So I'm looking for some sort of relationship between a weight and a volume. So let's look at 6.6. Here's our label. Okay, scan this. Okay, 1 milligram per milliliter. So basically in this case, a milligram and a milliliter are the same. So if I go to change this, I take 0.25 milligrams over 1, that's what I'm trying to change. And then we are told there is 1 milligram in every 1 milliliter. So basically all this is a unit change. You should administer 0.25 milliliters. .6. The physician orders Lexapro 10 milligrams by mouth once daily. Read the label in 6.7, which is down here, and to determine the number of milliliters you would administer to the patient. So again, I want to take 10 milligrams, some weight unit, and I want to change it into milliliters, so some volume unit. So I'm looking for some relationship, hopefully between milligrams and milliliters. There are 5 milligrams per 5 milliliters, which is equivalent to 1 milligram of the drug per milliliter. So basically this is the same as what we had before. But I'm going to use this one because why not use one that's not a 1? So I want to take 10 milligrams, that's what I'm trying to change. And we are told there are 5 milligrams or 5 milliliters. And then milligrams cancel, the 5s cancel, and you end up with 10 milliliters.